Heart failure doesn't always start with chest pain or a trip to the emergency room. Instead, it often begins slowly, so quietly that the earliest symptoms can feel like just getting older. You might feel a little more tired than usual. You might notice your shoes feel tighter at the end of the day. Or you might wake up in the middle of the night gasping for air, not knowing why. These small signals are your body's way of waving a warning flag. The truth? Catching these early symptoms could save your life. Early treatment can slow the progression of heart failure, reduce hospital visits, and help you live independently for years longer. In this video, we'll uncover the 13 most common early signs of heart failure, the ones most people ignore, but that your heart never misses. If you're over 60 or have high blood pressure, diabetes, or a family history of heart problems, please pay close attention. Even just one of these signs could be your wake-up call. What is heart failure? Heart failure doesn't mean your heart has completely stopped working. It means your heart can't pump blood as well as it should, leaving your body deprived of the oxygen and nutrients it needs to function. When this happens, blood can back up into the lungs, legs, and abdomen. Fluid builds up, breathing becomes harder, fatigue sets in. Over time, your organs, especially your kidneys, brain, and muscles, start to suffer too. Heart failure can affect the left side of the heart, making it harder to pump blood to the body, the right side, causing fluid buildup in the legs and belly, or both sides. It often develops slowly, especially in older adults, and may be mistaken for aging, arthritis, or just feeling tired. But untreated heart failure can lead to dangerous complications: stroke, kidney failure, liver congestion, and life-threatening arrhythmias. The good news? When caught early, heart failure can often be managed, sometimes even reversed, with lifestyle changes and the right care. Now let's break down the 13 early signs of heart failure you might be ignoring. 1. Shortness of breath, even during light activity. If you find yourself gasping for air after climbing a single flight of stairs or feeling breathless while getting dressed or walking across the room, it's not just age catching up with you. This type of shortness of breath happens when the heart can't pump efficiently, causing fluid to accumulate in the lungs. As a result, even mild activities feel exhausting, and lying flat may worsen the sensation. Some people notice they wake up at night struggling to breathe or need to prop themselves up on extra pillows just to sleep comfortably. It's a red flag that something deeper is going on with your heart's ability to keep up. 2. Fatigue that won't go away. You sleep through the night, but still wake up feeling drained. You skip social events, errands feel overwhelming, and even simple tasks like cooking or walking to the mailbox leave you exhausted. This deep, unshakable fatigue isn't just about aging. It could be your heart. When the heart's pumping ability declines, it can't deliver enough oxygen and nutrients to your muscles and organs. As a result, your body goes into low power mode, making you feel sluggish, weak, and less motivated, even after a full night's rest. If you're feeling unusually tired and it's affecting your daily life, don't brush it off. It may be your heart waving a warning flag, but the next sign may be even more visible. 3. Swollen ankles, feet, or legs. If your socks leave deep imprints, or your shoes feel tighter by evening, it may be more than just salt or standing too long. This kind of swelling, especially in the ankles, feet, or lower legs, is often a sign of fluid buildup, edema, caused by the heart's inability to pump blood efficiently. When the heart weakens, blood begins to back up in the veins, and fluid leaks into surrounding tissues, starting with the legs due to gravity. It might not hurt at first, but it's your body's way of saying something's wrong inside. Watch closely. Is one leg puffier than the other? Does the swelling get worse as the day goes on? Don't dismiss it as just getting older. And here's a major red flag to watch next. 4. Rapid weight gain, over 2 to 3 pounds in 24-48 hours. If your weight jumps up by 2 to 3 pounds overnight or within a couple of days and you haven't changed your diet, this is not normal. This isn't fat gain, it's fluid retention. When the heart can't pump blood effectively, fluid builds up in the tissues and bloodstream. The scale becomes one of the first silent alarms. Many people ignore this warning, thinking it's just a bad eating day. But if your clothes feel tighter, your rings don't fit, and your shoes suddenly feel snug, it could point to worsening heart function. Keep a weight log. If you gain quickly without explanation, talk to your doctor. Acting early can prevent serious complications, but fluid buildup doesn't just affect weight. Watch for this next subtle signal. 5. Loss of appetite or feeling full. Quickly. If you find yourself eating less or feeling full after just a few bites, don't ignore it. This isn't just a random digestive issue, it could be a sign of heart failure. When the heart weakens, fluid can back up into the liver and digestive tract. This congestion interferes with normal digestion, making you feel bloated, nauseous, or uncomfortable even without eating much. Over time, this leads to unintentional weight loss, weakness, and nutrient deficiencies. Seniors often mistake this for a simple stomach issue or aging metabolism, but it may be your heart struggling to keep up. If you notice this change in appetite, especially along with fatigue or swelling, it's time to talk to your doctor. But what if you're also waking up several times a night just to pee? That could be another important clue. Let's talk about it next. 6. Increased nighttime urination. If you're waking up multiple times each night to urinate, don't dismiss it as just aging. This could be your heart quietly signaling distress. In early heart failure, fluid often builds up in the legs during the day due to poor circulation. When you lie down at night, gravity shifts that fluid back into the bloodstream, and your kidneys respond by producing more urine, leading to frequent nighttime bathroom trips. This symptom, called nocturia, is especially common in seniors and is often misattributed to prostate issues or overactive bladder. But if it's new, persistent, or accompanied by swelling or fatigue, your heart might be the real cause. But what if your heart is also affecting your lungs, causing a cough that just won't go away? Let's explore next 7. Persistent cough or wheezing. If you've developed a nagging cough that doesn't go away, or you find yourself wheezing, especially when lying down, it might not be allergies or a leftover cold. In early heart failure, your heart struggles to pump blood efficiently, causing fluid to back up into the lungs. This leads to a wet or dry cough, shortness of breath, and sometimes a wheezing sound. You might also notice this cough gets worse at night or when you lie flat. Over time, this buildup of fluid can make simple tasks like sleeping or walking feel more difficult. Don't ignore it. This symptom could be your heart trying to get your attention. Curious why you've been propping up pillows at night just to breathe better? 8. Trouble sleeping. Flat, needing more pillows. Do you find yourself stacking extra pillows at night just to breathe comfortably? That's not just aging, it could be a warning sign of heart failure. When the heart struggles to pump blood efficiently, fluid can accumulate in the lungs, especially when lying flat. This is called pulmonary congestion, and it makes breathing feel more difficult when you're in a horizontal position. Many people with early heart failure report needing to sleep propped up or even in a recliner. If you've gone from 1 pillow to 3 or can't sleep flat without gasping for air, it's time to pay attention. But what if it's more than just breathing trouble? Let's find out. 9. Chest tightness or discomfort, not just pain. Heart failure symptoms aren't always dramatic. You might not feel stabbing pain, but a constant pressure, squeezing, or heaviness in your chest, especially during physical activity or emotional stress, could signal a struggling heart. Some people describe it as an elephant sitting on their chest, or a tight band around the ribs. This kind of discomfort may come and go, and it's easy to dismiss it as indigestion, muscle strain, or just getting older. But it's one of the body's clearest red flags that blood isn't circulating properly and oxygen delivery is being compromised. And what happens when your heart starts racing, unexpectedly and without reason? Don't miss the next sign. 10. Fast or irregular heartbeat. When your heart isn't pumping efficiently, it may try to make up for it by beating faster or irregularly. This can feel like a flutter, a skipped beat, or a racing pulse, even while you're resting. It's the heart's way of trying to push more blood through your body when its pumping power is weakened. While occasional irregular beats can be harmless, frequent or persistent changes may point to electrical disturbances caused by heart failure. Over time, this can strain the heart even more, increasing the risk of complications like stroke or sudden cardiac events. But what if your heartbeat is fine, but your hands and feet are always freezing? That could be a circulation warning sign. 11. Cold hands and feet. If your hands and feet often feel cold, despite the room being warm, it could be a subtle warning sign. When the heart isn't pumping efficiently, it prioritizes sending blood to vital organs like the brain and heart, reducing flow to the extremities. This poor circulation results in cold, sometimes even pale or bluish fingers and toes. While it might seem like a small issue, it reflects a bigger problem. Your body is struggling to distribute blood where it's needed most. Seniors with heart failure often overlook this as a simple age-related change, but it can be a critical early clue. But what happens when poor blood flow reaches the brain? The next sign is more surprising than you think. 12. Mental confusion or difficulty focusing. If you've been feeling unusually forgetful, easily confused, or unable to concentrate, don't ignore it. These symptoms aren't always about aging. Your brain relies on a steady flow of oxygen-rich blood to function properly. In heart failure, the weakened heart can't pump enough blood to meet the brain's needs, leading to foggy thinking, memory issues, or even sudden dizziness. Some seniors describe it as feeling off or not quite present. These changes can appear gradually and are often mistaken for stress or fatigue, but they may actually signal poor circulation caused by a struggling heart. But what if your body is sounding the alarm in another way, through constant unease or nervous energy? Coming up in next sign, a symptom many people never link to heart failure. 13. Persistent feeling of anxiety or restlessness. That nagging sense of unease, tension in your chest, or feeling like you can't relax, even when you're not stressed, might not just be in your head. In fact, persistent anxiety or restlessness can be a physical symptom of heart failure. When the heart isn't pumping efficiently, oxygen levels in the body drop, triggering your nervous system to stay on high alert. You may feel short of breath, unable to sit still, or have a racing mind at night. It's your body's way of trying to compensate for poor circulation and reduced oxygen to the brain and muscles. This symptom often gets brushed off as just stress, but it's worth paying attention to, especially if paired with fatigue, swelling, or shortness of breath. So when should you take action? Don't miss this life-saving advice. When to see a doctor. If you notice 2 or more of these symptoms showing up regularly, like fatigue, swelling, shortness of breath, or mental fog, don't ignore them. Especially if you have a history of high blood pressure, diabetes, kidney disease, or a previous heart attack, your risk of heart failure is much higher. These signs aren't just part of getting older. They're your body's way of waving a red flag. Make an appointment with your doctor and ask specifically about a heart function evaluation. This may include blood tests, an echocardiogram, or an EKG to check how well your heart is pumping. Catching heart failure early gives you the best chance to manage it effectively, avoid dangerous complications, and improve your daily energy and lifespan. Heart failure doesn't happen overnight, it speaks in whispers long before it shouts. The small signs you brush off as just aging may actually be your body's cry for help. To recap, here are the 13 early signs of heart failure you should never ignore: shortness of breath, fatigue that won't go away, swelling in ankles, feet, or legs, rapid weight gain over a day or two, loss of appetite or feeling full quickly, increased nighttime urination, persistent cough or wheezing, needing multiple pillows to sleep, chest tightness or pressure, fast or irregular heartbeat, cold hands and feet, mental confusion or forgetfulness, a constant feeling of anxiety or restlessness. These aren't just random symptoms, they're signals your heart may not be pumping blood as efficiently as it should. The good news? Heart failure is manageable, especially when caught early. With the right lifestyle changes, medications, and support, you can dramatically improve your quality of life. If this article opened your eyes, please share it with someone over 60. You might help them catch something before it becomes serious. And let me know in the comments, which of these signs have you or a loved one been ignoring? Stay tuned for more senior health tips to protect your heart, brain, and body so you can age with strength, independence, and clarity.